Chronic knee pain can often be quite debilitating, and 90% of the time people assume that it's due to age, wear and tear, and arthritis. But very often patients will come in being told, oh, I need a new knee, it's arthritis, there's probably nothing you can do. And actually when we assess the knee, it looks pretty good. And so the first thing that you have to assess is simply the size of the joint. Is the joint enlarged, not from swelling, but from actual bone? And so the way that you'll tell the difference is it soft or hard? If the joint is double the size of the other joint and it's rock solid firm, then what that suggests is there's probably a little bit of arthritis in that joint. And what happens is bone will lay down along lines of force. And so if you've overloaded that knee for years and years and years, the bone will thicken and it will get bigger. And as it gets bigger, there's now less room for the joint to move. And so generally associated with that will be a real lack of ability to bend the knee. Sometimes, even in those cases, people can get 40 or 50% less pain, because pain isn't just about the structure. Pain is a decision made by the brain on whether it wants to inform you of what it thinks is dangerous. And so I've certainly seen many people with knees that look awful, but actually they're fine. They're walking, up hills, mountains, and they have no pain at all. And so we have to kind of take it all with a pinch of salt and really assess the function of the knee. If you're able to connect to the muscles around the knee and keep them really, really strong, the likelihood of having the pain ongoing is much less. So the first thing is look at the size of the joint and is it hard or soft? Is there any recurrent swelling in there, suggesting other types of damage that may be in the joint? How much ability is there to bend or straighten the knee? Does it feel flexible? If it's still quite mobile, but it hurts, then it's less likely to be a degenerative picture. But even if it is, it doesn't mean that there's no chance of help. And so we'll go through this with you to try and understand how much damage might there be in the knee versus how much improvement can there be. Because aside from a degenerative picture, if there's any structural change in the joint, that would tend to be a chronic tendon problem. And this is an overloading of that tendon, or tendinitis, tendinopathy, typically on the front of the knee, whereby it overworks to compensate very often for inefficiencies elsewhere. And so the trouble with the knee is it's stuck between a very mobile ankle and a very mobile hip, whereas the knee is more of a hinge joint and it can't do too much. And so it very often gets overloaded. And so in the absence of any real structural problem, 80% of the time we find that the knee is actually not the problem. It's the bit that hurts, but it's not the problem. The problem is very often in the hip or the ankle. And getting those to move better is really the main thing to getting people out of knee pain. Because in terms of walking, if my ankle or my arch doesn't flatten well and arch back up again, my knee has to move differently. It doesn't have a choice. And so a lack of movement in the ankle is always going to overstrain that knee repetitively. The goal eventually in a tendinopathy is to build strength in that tendon, because research has shown us that the only thing to change the structure of that tendon is overloading it with force, and then it will adapt over time. But we need to make sure that you're at the start line and that you're ready to do that, because if you're not ready, you're just going to cause flare-ups of that pain. And so to summarize, we need to figure out, is this a structural problem or is it more of a functional one? Because maybe there's no damage and maybe there's no tendinitis. Instead, it's just compensation of muscle tissue tightening up all the time to try and protect you. Most commonly, there's a small muscle at the back of the knee that really goes into overdrive when trying to compensate. And this can cause some pain in the back of the knee, which wraps around the side, and it's quite common. Could even be driven from the hip or the low back, where muscle tension and stiffness can impinge nerves that will give knee pain and perhaps no back pain at all. And so looking at the mobility of all these joints, the stability of all these joints is really the key to getting you out of pain. Desensitizing past injuries, promoting movement, and eventually strengthening.